People with health anxiety have concerns and worries about seeing doctors and medical providers. Some have a difficult time trusting doctors and tend to avoid them altogether, and others seek reassurance from doctors almost too often in an attempt to lower their anxiety. And still others fear that their doctors aren't taking them seriously because of their health anxiety. Well, today I'm going to ask my favorite physician some challenging questions from a physician's point of view regarding seeing patients with physical symptoms likely caused by anxiety. And many of these questions came from people that are taking my health anxiety course, as well as clients that I see with severe health anxiety. Now, if you have health anxiety, you're likely concerned that something may be seriously wrong with your physical or your mental health. And you may feel, certain bodily sensations and have certain symptoms that alarm you. And these bodily symptoms can even change over time. Now, some people with health anxiety may have diagnosed medical conditions, while others may not. Yet in both cases, you can experience excessive worries to the point of preoccupying your mind and robbing the joy, right out of your life. So in severe cases of health anxiety, it becomes critical to sort out what bodily sensations and concerns are the result of anxiety and what is a real condition that requires medical attention. So anxiety is associated with many bodily changes and sensations, including things like shortness of breath, pounding or racing heart, chest tightness, muscle tension, fatigue, dizziness, nausea, stomach upset, diarrhea, flushing and sweating, tingling and numbness in the extremities and face, shakiness, throat tightness, lump in the throat, feelings of unreality and derealization and depersonalization, brain fog, feelings of dread, and the list just goes on and on. So many physical and mental symptoms can be mimicked by anxiety, yet if a person goes to a medical provider for physical conditions caused by anxiety, anxiety will be considered the last possible resort, while every possible medical cause will be screened, exhausted, and ruled out. Our medical system is designed to identify possible medical problems, and that makes sense, unless you have an anxiety condition, and it's not designed to identify, diagnose, or treat anxiety conditions. So when someone goes to a medical provider for an anxiety condition, it's like going to IKEA, for a light bulb, and you might be walking through aisle after aisle after aisle, only learning that the light bulbs are at the checkout. And to make matters worse, the more medical procedures and tests that you participate in to rule out these medical possibilities, the worse your anxiety becomes because your fear is being reinforced. Anxiety conditions are unintentionally reinforced in our medical system. And what helps people recover from anxiety disorders is just incomplete misalignment with the standard of care practices in our healthcare system. So many people I see for severe health anxiety, if they're not avoiders but are seekers of information, have already seen loads of doctors and have been to the ER multiple times and often leave without explanations. Now, we will talk more about this in a moment, but people with health anxiety have a risk of getting stuck in the medical system at this point. They get focused on having and searching for a real medical problem instead of treating psychological problem that's creating the physical symptoms. They get stuck in a health anxiety cycle of seeking out these opinions of many doctors and specialists, searching for reassurance because they feel this uncertainty and they really have no answers. Unfortunately, any reassurance given is very short-lived and, as I've said, reinforces this health anxiety cycle, making it worse in the long run. Dr. John Pradko has been practicing family care medicine for over 30 years and treats patients from birth to over 100 years old. I think he's seen it all in his medical career, and he's widely respected in the community and trains and mentors medical students and residents as well. And he also happens to be my husband. Welcome to my YouTube channel, John.
Thanks, Paige.
And thank you for agreeing to come on today to answer some questions and help people with health anxiety.
Sure.
I'm going to start with some basics. First, why should someone seek out medical attention?
Well, it really depends on your physical health and your medical history. If you're an elderly person or you have a serious illness, you might want to schedule regular medical appointments. I'll give you some bullet points. Generally, people should see their family doctor when they're experiencing new symptoms anywhere in their body. If they have experienced symptoms or changes that are more of a chronic disease, but something new's changed, such as blood in their urine, changes in their bowel movements or bowel function can be another reason for that. Or when symptoms of chronic disease flare up, such as colitis or a sudden change in a diabetic's blood sugars. Also, we see people who are needing maintenance, physical exams, renewal of prescriptions.
Okay. And from a physician's standpoint, let me know, what are you concentrating on when you first see a patient?
That's a good question. Well, I'm starting by introducing myself and beginning the building of a relationship whereby they can trust me and help ease the unheard questions that a lot of people have. I'm listening to their chief complaint, and I'm doing investigative work that includes gathering medical history and associated symptoms related to their chief complaint. Then I'll complete a complete medical exam. It often might lead to ordering tests, procedures like lab work, EKG, urinalysis, or radiographic procedures.
That makes sense. And when should somebody go to an emergency room versus seeing their family doctor?
Another good question. If a person is unsure, they're having an emergency, if they can call their family doctor, that's often helpful. Family medicine does not treat medical or surgical emergencies, but we can help you determine whether emergent care is necessary or to be seen in the office.
Okay. And what's the protocol when someone has these physical and mental symptoms that you have a hunch might be caused from anxiety? But let me give you an example. Let's say a healthy 40-year-old male comes into your office and he explains that last week while he was, sitting at his desk, he had skipped heartbeats and an increased heart rate. And then he started sweating. He was feeling dizzy and disoriented. His breathing became a little bit more difficult. What about a patient like that?
It's a common patient. For a patient with those complaints, we would do a thorough evaluation of all the possibilities that this set of symptoms might lead to. The doctor's faced with the large prospect of ruling out a number of possibilities. I'm most likely going to order EKG or blood work and subsequent diagnostics that would help narrow and rationally come to an efficient conclusion.
And then if all of the tests are completed, and let's say that all the results show no abnormalities, no problems, what are they diagnosed with? Are they referred to an anxiety specialist?
When the profession itself completes the exhaustive medical evaluation and we yield normal results, we might wonder if the physical symptoms are a result of anxiety. And I would discuss that with the patient as sincerely and calmly as possible and help them seek psychological care.
So it sounds like if somebody goes to the doctor with these physical symptoms and they're known to be possible causes of, anxiety appears to be the culprit. Anxiety is not really considered until all other possible medical causes have been exhausted.
That's very correct.
So it sounds like it could take months. It could possibly never come to that conclusion.
Exactly.
Yeah. And so what if that same person, begins to visit multiple doctors in multiple hospital systems because they're just looking for answers. They're seeking for some kind of medical explanation.
Well, that poor person honestly gets trapped in the medical system as it exists in the United States. The individual has to realize that a lot of doctors can't see each other's testing results, appointments, and mixed messages are often given to the patient.
Yeah, that would really, that would be so hard and so frustrating for that person. How is a person diagnosed if they go to the ER believing that they're having a heart attack with those symptoms? And then after testing, probably it was a panic attack, everything's normal. Is that person diagnosed with anything? Are they referred to an anxiety specialist?
A common phrase from an ER diagnosis would be non-cardiac chest pain, and they would be referred back to their family doctor. Then the family doctor would begin the investigation into the other possibilities that could cause those symptoms. There are numerous: esophageal spasm, rib arthritis or pain, pleurisy, thyroid conditions, gallbladder symptoms, intestinal symptoms, etc.
I can really see where this is a problem because it becomes this endless kind of vast variety of medical conditions that it could possibly be. And yet anxiety, if it's the root cause, the culprit, it's just not really kind of concluded. And if we only knew anxiety was the culprit up front, we could save this person so much needless worry, time, and expense. And it's almost like the health care system is perpetuating or reinforcing the health anxiety.
That's right.
So doctors are really taught to look for horses instead of zebras, right?
That's on a medical basis.
But in the case of the anxiety condition, it's like the anxiety condition is the horse, but it never really gets to that point. It never really gets recognized.
Yes.
Now, do physicians diagnose people with health anxiety? It's in the mental health field. We diagnose people with health anxiety as illness anxiety disorder or somatic symptom disorder, sometimes panic disorder. Is the health anxiety, is that diagnosed in a medical setting?
A good question. The average medical physician is reluctant to make a firm mental health diagnosis without referral to a mental health provider.
And if a patient has a history of health anxiety, would you want to know that information? I mean, would that change how you might treat that patient? Would it make it less likely for you to take them seriously?
That information is so important, and I would really encourage any of your subscribers or any mental health people to make that known to their provider. It would not be something that would scare the provider, but help them make a better coordination of care.
Yeah. Okay, I have a few more questions that came from people taking my health anxiety class.
Okay.
Now, what happens when someone experiences white coat syndrome and they have an elevated blood pressure in the doctor's office?
That is very common. I'll tell you that. It's a phenomenon we see associated with what we call anticipatory anxiety. It is often seen repetitively, and these people are in good health, and I'd encourage them to get a blood pressure cuff, check regularly outside the office, and then report back those readings.
Now, are there natural products or supplements that would help somebody with anxiety?
Well, we start with promoting really a healthy lifestyle improvement. Look at their lifestyle, work on that first. That might include something as simple as more sleep, more water, but balancing the lifestyle would be much more impactful than any supplement initially.
And what kind of medications might help somebody with anxiety, health anxiety or even panic disorder?
A family doctor might often start with a prescription of something called buspirone. It's a relatively safe medication, and sometimes we'll use an antidepressant, especially if they have OCD or health anxiety. But every patient is different, and we work in tandem with the mental health professionals.
Now, can you give a patient absolute, a certainty about the status of their health?
Wouldn't that be wonderful? I wish I had that in my own life. But we can't. We're all humans, and I try to tell people that all your results look good and they're in the normal range and promote a healthy lifestyle. But that's part of the life struggle we have.
Thank you so much for participating in this interview and helping all of us gain some insight into our healthcare system and how our medical system, it's really not designed to identify anxiety disorders.
It's not.
I mean, it's just important to kind of understand how that works and know that. Now, I have a PDF called Why Do I Feel That in My Body? And it's explanations of bodily symptoms due to anxiety, stress, and panic. And you can find that at pagepradko.com, and I'll also leave you a link in the description below. Thank you again.
You're welcome.
Thank you for watching, and until next time, I'll see you in session. Take care. Bye-bye.